From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin. Let's be real, dental anxiety. It's a thing. In fact, studies show that approximately 36% of people in the US experience some level of dental fear, with about 12% having an extreme fear. Whether it's the sound of the drill, the thought of needles, or just an unfamiliar setting, many of us feel uneasy about dental visits. Today, we're chatting with Dr. Justin Griffin, a dentist who's on a mission to change the way we think about dental appointments. Dr. Griffin is a top dentist in Columbia, South Carolina, and the founder of Wildwood Aesthetic Dentistry. What really sets him apart, though, is how he makes dental visits fun. Yes, you heard that right. And he does the same on his TikTok channel at @smile_doc. He's got all the tips and tricks to make that dentist chair feel a whole lot less intimidating. So if you're looking for a dentist who knows how to put you at ease while transforming your smile, Dr. Griffin's your guy. Dr. Griffin, we're so thrilled to have you here on the Care Experts podcast today to talk all about dental anxiety. To kick things off, can you just tell us a little bit about what inspired you to go into dentistry?
Well, I knew for a long time. Thank you. I'm glad to be here. What inspired me to go into dentistry, I knew I wanted to do something in healthcare, and I knew I wanted to be directly involved with patients. And oddly, like I'm aware of like some strengths that I have and all the weaknesses that I have. Like there's not many things that I'm really good at, but one of the things that I know that I was given as a gift was to help people feel comfortable. I don't know how, I don't know why. It's just something I can do. I can break down barriers and I can make people laugh when they're in stressful situations. And there's not much more stressful than the dentist. And when I was trying to decide whether I was going to go into medicine or to dentistry, I mean, there's a longer story to that, but I do feel like it's just a better fit for me. I feel like I can have the most impact, not only with the actual dentistry, but with the way I can help people change the way they feel about dentistry.
Amazing.
So that's right. That's why I do it.
That is why you are sitting in the chair across from me with a huge social media following and almost 25 years in your profession.
Yeah.
I'm so fascinated by this. Like, people love looking at dentistry photos, pictures of veneers, pictures of dentists at work, the before and after photos, and yet there's so much fear and anxiety around actually going to the dentist.
A lot of people who watch my videos send me messages that say, I'm afraid of the dentist. So that is exactly true. I mean, I have people that say, I'm fascinated by, like, they came in to get a root canal. Like, I've been all over YouTube watching these and trying to figure out what they're doing, what you're going to be doing.
Wow.
You know, so yeah, there's definitely an interest that somehow anxiety doesn't play into that. They like watching it.
In general, do you think that social media and being able to access these videos and seeing these images is helpful to people in helping them understand with a little bit more context what's happening?
For sure.
Or is it perpetuating anxiety because now they can know too much?
I think people find peace in knowledge.
In knowledge, absolutely.
And so the more they understand what they're going to do, the more they understand thousands, millions of people have done what you're about to do, it brings them a little bit of comfort. Like, if they can do it, I can do it.
I'm sure that in your almost 25 years of practicing as a dentist, you've come up against this once or twice in your practice.
Almost every day.
Okay, almost every day. That was one of my first questions is, how often does dental anxiety become a concern for people?
So the anxiety part is on a spectrum because most people don't like it, and some people are extremely fearful, right? And so and everyone else falls somewhere in between that.
Yes.
But I mean, every single day, someone says, "I hate being here." You know what I mean? That's what you get every day.
What are the top things that you think or that you hear from people make them really nervous?
Most of the time, it's the shots. They don't like those, even though some of them come with tattoos all over their body. They don't like dental needles or something else.
Yeah.
And it is tender space. I get that. And it's it seems more intimate or invasive, I guess. But so the shots, the drills or sounds, that's really big. Even the smells. Some dental offices have a traditional like smell. There's some medicines that are used in dental offices that produce this smell, and it'll bring back memories from people. And things have changed a lot in sometimes 50 years or 40 or 30 years. So when they were children and they were in the dental office, they had an experience with or without anesthesia, or with or without a person that had good chairside manner. You know what I mean? And so things have changed a lot, but you can't uproot some of those memories and feelings.
Yeah, there's that saying, the body keeps score. So you might have had a past experience, and now every time you walk into a dental clinic, your hands are sweating and your mind's racing, and it just brings back, as you said, that same feeling.
That's right.
Do you have any examples of an extreme case of anxiety that you've had to walk somebody through or talk them through?
Well, I have many. So, you know, when you say fear, like you just described it, hands are sweaty. They come in for the consult before the first word comes out of their mouth. They're crying. They're already crying, and I'm like, nice to meet you. And it's real. For some people, it's very real. And I do the same procedure on them that I do on everyone else, but for them, it takes on a whole different meaning and feeling and all that. So, but you know, it's helping them get from that point of extreme phobia, fear, to I don't like the dentist, but I don't mind going anymore.
Yes.
Like converting them to that. It's you have to approach it from every single angle. So not only the dentist has to be compassionate, the voice, the tone, every team member's attitude has to be welcoming and warm. The environment, the sounds, the smells, the marketing, I mean, the phone call, everything. All those layers have to be lined up for them to start to break down those barriers or walls that they have with dentistry. So you start with instead of saying, hey, you need 4 root canals, let's go. You know, maybe you start with, let's do 1 filling. You know, or even maybe they'll do sedation the first time, and then the next time they only need like a filling. And so you're like, let's just do this 1 filling. It's in an area where you're not even barely going to feel the shot, and so it's just baby steps.
Yes, baby steps.
Even
always.
with kids, if I can say this now, even with kids. Moms and dads are like, I can't take off work, so we're doing all of their fillings in 1 appointment, and that sets them up for a terrible history for dentistry, a terrible future, I guess is a better way to put it. And so I just tell parents, we do 1 at a time. We do 1 filling at a time. Sorry, you're gonna have to take off more work, but I'm not setting them up to have a bad experience in dentistry.
I never thought about that, but you're so right. It really is about creating from a young age a really great relationship and a space that feels safe so that people can continue to keep up with their oral hygiene.
Yeah.
Now, dental anxiety is uncomfortable, as anxiety, you know, anyone who's experienced anxiety, which is most people at this point, would know, but it kind of comes with a different consequence, which is if that dental anxiety is holding you back from actually getting to the dentist office, your oral hygiene is suffering as well.
Yeah. And it's easy to put off dentistry because most of it is preventive. Like if you're already feeling pain, whatever it is has gone too far.
Yes.
Almost like heart disease, you know. So if you you know, what's the saying? An ounce of prevention is worth a pound of cure. And so, you know, you what they don't realize is by doing smaller fillings that aren't as painful, that won't cause as much anxiety, that's also cheaper, doing those little things along the way is going to prevent you from having those really big dental moments where you've got to be sedated or have several teeth taken out or something else.
Yes.
The anxiety that prevents you from going to the dentist can set you up for a dental nightmare, especially if there's an infection in the gums or in the teeth. I mean, when you think about a dental infection, it's only this close to the brain.
Right.
And it spreads fast. It can cause a lot of systemic issues. It's not just about the teeth.
I want to go into some tools that will support individuals who are experiencing dental anxiety, or maybe they have a child who's experiencing dental anxiety. But before we get to that part, I would love to just dive a little bit more deeply into some of the things that you find really trigger people who are coming in to the dentist. You mentioned drilling as one thing, having cavities filled. Are there any other things that come up commonly for people?
Other than the things that that trigger them is, like the drills, the shots, and the sights, sounds, all of that. They get a lot of anxiety sitting in the chair. You don't even have to inject them with epinephrine. Their heart's already beaten, and
going.
Yeah.
I imagine for many people, it's a bit of a feeling of a loss of control. Like they are opening their mouth, have somebody who is looking in their mouth, doing things that they're not really familiar with. It's pretty vulnerable, as you said.
For sure.
Before. Are there any strategies that could help someone feel a little bit more in control in the experience with the dentist?
Before I get to the control, what they could do, you had mentioned they feel out of control. And I think the two biggest things that cause the fear, if you take out the past experiences, is number one, they don't know what's about to happen. And so they're on the edge of their seat, even though they're numb, waiting for something, because you can't see what they're doing. And the other thing is trust. It's all about trust. There's like 3 of the most common questions I get, and I get thousands of questions on social media from people from all over the world. And one of the most common things that is said is, how do I get over fear of the dentist?
Yes.
And my first response to them is, you got to find a new dentist. If you're afraid of your dentist, you need to find a new dentist.
Right.
You need to find someone that is warm and caring, that's going to hold your hand through these things, that's patient enough to do that. And so patients want one of two things. They either don't want to know anything, or like, tell me when you're doing something, I'm going to close. Like,
that's me.
I don't want to know.
Yes.
Or they're like, if you could just tell me everything that you're doing.
Right.
And so, and I think patients need to feel empowered. Okay. So number one, you need to feel like you can ask your dentist, can you tell me what you're doing?
Yes.
Can you show me pictures of why we're doing this? What's happening? How often, you're sort of interviewing the dentist. And a lot of people would ask me, how do I find a dentist like you're describing when you say find a new dentist? And I tell them, you have to call around and you got to interview them.
Yeah.
And some dentists are like, I don't do that. Well, that's not your guy or gal.
No.
They can bring a friend, a parent, a loved one with them to sit in the room. That's fine. I always tell patients that are a little bit nervous, I'm like, dress comfortably, wear some sweats. It's, sweatpants, sweat clothes day or whatever.
Yes. Get comfy.
Yeah. Get comfortable, make sure, and bring something to keep you warm. Like a sweatshirt is nice. So you want to be warm, bring some headphones, find something you're really interested in, like a podcast, or some good music, and then, turn up the radio, right? Just
get that music going. Yes. Okay. Some noise canceling headphones, having a conversation or interviewing a dentist before you start working with them, especially if previously you've been with a dentist where you didn't feel super comfortable.
Right.
I'm thinking, when my daughter first went for her first dentist appointment, I sat with her and I remember giving her my arm and just telling her, if, at any point you want them to stop and you don't feel comfortable saying that, just squeeze my arm and I'll say it. And so I'm wondering as well, like having a little sign or something that you give the dentist, like if I put my hand up like this, I need you to stop right away. Is that allowed? Yeah.
And we tell them that, like, it's communication is always king. It doesn't matter what we're talking about. So if I always tell patients when I have these magnification loops on, like I can't see their face. So I can't see them wince like in their eyes. Yeah. So I tell them, like, I can't see your eyes. And your mouth is open. So just all you have to do is just I can see that hand.
Yes.
And so just raise your hand. I'll stop. You're in total control. You have to tell them that. Okay. Even though they can always refuse, like, I'm done, I'm out. They're in control, but they need to feel like they're in control. So good communication with them, letting them know that they're in control. And sometimes when we think that they're numb, they're not numb. Now, sometimes when I know they're numb,
yes, they don't think they'll numb.
Still say, I want more. Like, I literally have not even touched them with the needle.
Right.
Because I thought that they weren't being honest. And I'm like, can you feel that? And they're like, oh, yeah. I'm like, okay.
That is anxiety,
That's anxiety.
It plays tricks on the mind, and you think you're feeling something when it's not even there.
But there are times when they should be numb. All of the signs tell me as the dentist they're numb. And then they're still able to feel certain parts of certain teeth. And you got to take that serious also. You got to do what you can to get them profusely and profoundly numb.
Yeah. It is, as you mentioned before, a lot of it is about coming in and taking these little baby steps. So maybe they do need a cavity filled, but the first appointment you come for a cleaning and you talk about the cavity being filled, but we don't actually do anything about it. And the next time you come back and we try again, you know, it might take a couple goes to get there.
And as you do that, as you sort of nurture people over years sometimes, like there are patients now that come in for their cleanings, and every 6 months they ask me the same thing. Do you remember, Dr. Griffin, that first appointment? Like they're so proud that they've converted to a, you know, not so hyper anxious appointment that it's a real sense of accomplishment for them.
Exposure therapy is perfect example.
Yeah.
Okay, so somebody is coming in, they've had a conversation, they've interviewed you as a dentist, they've come in, they've had a conversation, let you know that they feel anxious about it. Do most people, do you think, feel comfortable saying that? Or
well, so that's another thing. When you read the statistics on how many people may have anxiety or fear at the dentist, how many of them are actually confessing? Because of pride, you know. Not
everyone's sitting down and saying, I don't like this, do you?
No. Right. They won't. They don't feel comfortable telling you. So to me, I think it's important as a dentist to just be aware they may not be being completely honest about it. And you can't just go in and start taking care of the dentistry.
We have to remember, though, that at the core, dentists are there to help us, not to hurt us. Like you are, as you said, doing this preventative work so that we don't undergo a lot of pain in the future. Knowing that there are probably some anxious people listening to this episode, I want to be mindful of not injecting more fear into people. But rather, quote unquote, injecting, but rather reminding people as to why it is important to go for those biannual appointments. Yeah. First of all, would you say that that's right? Every 6 months or so, we should be going to the dentist?
You know, that's 6 months that's set up by your insurance company. Okay. Not normally by your dentist.
Okay. What's the dentist recommendation?
The dentist recommendation and the ADA say 3 to 4 times. 3 to 4 times per year.
Okay.
And I can tell you, like, I go about twice a year only because I'm just busy. Yeah. And I can tell when I'm flossing, I'm like, oh man, I can tell there's some calculus in these spots. So I go in and I see the hygienist. But that's just it, is stuff starts to settle underneath your gums and you can't clean it. And it just sits there.
Yeah. So typically minimum twice a year. And the reason that we're going is so that we don't end up with gum disease, cavities. Yes. What else are you trying
to pick up on things early. Yeah. And that's the thing. And there's a lot. I see everything out there on social media. There's a lot of distrust with dentists, like mechanics, like a lot of industries. There's a lot of distrust, and a lot of that is because the patients can't see it. So if the dentist has really good intraoral photography, and I mean high definition, clear, there might be saliva bubbles all over those pictures. You know, you got to be able to show them, and then you just show the patient the conditions and say, I would work on this. It'll grow up to be a crown. It'll grow up to be a root canal. Just let them know the risks of non-treatment. And then they can make their own decisions. But yeah, you want to be seen more frequently so you can pick up on early signs of gum disease, which can lead to tooth loss or infection, early signs of tooth decay, early signs of wear, early signs of mobility. I mean, there's a lot of things you look for when you do the exams, not to mention oral cancer. But
what would you say to somebody who's listening to this right now and just listening to it, their palms are sweating a little bit. They haven't been to the dentist in a few years.
Sure.
They're feeling quite a bit of shame about what might be going on in their mouth. What's the first step?
Well, first thing is, as a dentist, most dentists don't care about the past.
Oh, interesting.
Like we just don't. We're not. It doesn't come. I mean, it shouldn't come from a place of judgment, ridicule, shame. I mean, that's in their minds. We just care about where you are. We do care about why you are where you are.
Yes.
If there was a systemic health issue you had, or maybe it's genetics, maybe it's habits, right? When we talked about going to the dentist regularly for prevention, there's also things you learn when you go and see your hygienist. She's going to say, I can tell you're not cleaning this area really well.
Yes.
And so let me show you a technique that we use to get under that bridge or to do something. And so you're missing out on all that education too that could make things easier.
Yeah, and just that reminder, like before you go, they're going to ask if you've been flossing.
Yeah.
And then
Yeah.
you're going to floss for a bit afterwards, right?
Sure.
Or until the next appointment.
Hopefully. I mean, it's really, those things, they're real. And you got to create those habits or it catches up with you like anything else.
Yes, of course.
So back to what would I tell them if they haven't been in a long time? I would tell them the only thing that you're guaranteed is if you delay another day, it'll be worse. Guaranteed.
Yeah.
And so as bad as it is now, it's going to be worse. And you got to do it.
I have some awesome questions from our audience, but one thing I just wanted to flag based on something that I've heard personally from a few people is that a lot of people who are struggling with their mental health, whether it's depression or anxiety, will sometimes go through a dip or a period where brushing their teeth falls to the bottom of the to-do list. And then they come out of it and that shame is there as well. So I don't even know if I have a question as much as I just want to say if anyone's listening and they've ever felt that themselves, or you're in a state of feeling depressed or anxious and it feels very hard to care for your teeth, that it's okay and you're not alone. And there are certainly lots of people who go through it.
Yeah.
And whenever you're ready, get yourself to a dentist.
I couldn't have said that better myself. It's just important that as soon as you can, you connect back with a dentist that cares, and they're going to hold your hand, get you right back on the horse.
Let this be your little reminder. We're cheering you on.
Yeah.
Okay. Ask me anything. What's the first thing I should do if my child is terrified of going to the dentist? I don't want to put them in a stressful situation, but they need to go.
The best thing you can do is, I think parents hand off the oral care responsibility prematurely. And so they think, oh, I've seen them brush, like they're good. They go brush your teeth and then they don't ever look at them again or monitor how they're doing. But I would not turn over the responsibility at all until they're at least 5 or 6. I would be doing it for them. And then they're going to be like, okay, this is something we do every day. Like this is life.
I think that we also want to be aware as parents not to project our own anxieties onto our children. So if we can keep the dentist as being a positive experience and take those deep breaths and really allow our children to have their own experience with a dentist, then that's going to really set them up for success.
I think parents sometimes even unconsciously will transfer that.
Yes.
It's like, sorry, you got a dental appointment. Like right there,
Right.
it's already negative.
We know it's a bad situation.
Yeah. And so if they've struggled going for a while, like they go and they have bad experiences, maybe it's the dental office. But you do have to be humble enough to look intrinsically and say, maybe I can change this environment a little bit, because we all want a pretty smile. We all want to be able to eat whatever we want, whenever we want.
Yes.
And so there's a cost for that. And I think that's a really good point about parents transferring their own anxieties to their children. But then there's that you're the parent, and it's a good conversation to have. It's not just dentistry, but there's going to be things you don't like to do.
Yes.
And that you got to do.
We just have to do them.
Yeah.
Okay, number 2, are there different techniques you recommend if I'm having a panic attack during a procedure versus just general dental anxiety?
Okay, so if this has happened before, I've seen it all.
You've seen it all.
I literally, I've had dental anxiety and I've had non-dental anxiety attacks.
Yes.
Like literally someone was in the chair and I'm working and tears. And I'm like, whoa, what's wrong? And they said, this song we played at my brother's funeral. And I'm like, oh my gosh, like turn the radio off.
Here we go. Next song.
Skip.
Yeah.
But then if you're having, I think it's important again that you speak up, and you need to speak up. And hopefully parents are teaching their kids that, or if you're an adult, you need to just say, pause. I'm raising my hand. Like I need a break for a second, and then just give them space. Let them take some deep breaths. Set them up. Yes, it might put you behind. like as the dentist, or the dental team.
Mm-hmm.
Yes, it might put you behind. It's going to slow you down. But what's most important?
Yeah.
We want them to come back.
Yes, absolutely. The last question I have for you is, I have dental anxiety because I experienced pain during cleanings due to my super sensitive gums. What options can I ask my dentist for before or during the cleaning to help ease both the pain and my stress?
Okay. Well, if the anxiety is coming from like pain,
Yes.
and it's just a cleaning, we don't
Yeah.
normally get numb for cleanings.
Right.
You can ask for, I'm glad that like someone is asking this. You can ask your dentist ahead of time for a prescription strength fluoride toothpaste. So a lot of people have heard of Sensodyne. It's a real popular for sensitive teeth. But there's something that's a little stronger. It's got a little more punch to it. And you can call ahead and say, listen, last time my teeth were really sensitive during the cleaning. Is there something that I can do? Or I heard about a prescription for a fluoride toothpaste. That will take the edge off. You don't do it the day of. You got to do it for a few days before, maybe a week before.
Okay.
And it will take the sensitivity way down.
Right down.
That's number one. Number two is there is some topical anesthetics that are available to hygienists if they have it in stock. There's also local anesthetics that can be used that's not like the dentist coming in and giving a shot.
Right.
And then ultimately you could do like the shot. I think it's always important to ask this question. Why are you having the sensitivity? So the analogy that I use with people is if you have a flat tire, you can put air in the tire and it will pump up for a little bit, but it's not going to fix the problem.
Right.
Why? What's the source of the problem? You got to get the nail out and you got to patch it, and fix it so it doesn't leak anymore. What's the source of it? So to fix teeth that are sensitive, it could be caused from grinding your teeth and you don't know it. People are like, I don't grind. And I'm like, you see this? You see your teeth?
You are a grinder,
sir. So sometimes they don't know it, but you could be from grinding. That'll make them sensitive. It could be from recession. Could be from decay. So there's lots of reasons why. I think it's important to say, hey, dentist, also, in addition to this prescription, could you help me sort of assess what the problem is?
Right.
So that I can fix it.
Amazing.
But something that's really interesting, I tell patients sometimes when they're like my hygienist will give me a report when I go in, and she'll say, really sensitive around this one area when I was cleaning. And I ask the patient, are you sensitive there any other time? They're like, never. I'm like, okay, well then I'm not really worried about it. The hygienist is using instruments in places that toothbrushes don't go.
Right.
Teeth can be sensitive down there, so that's okay.
Okay, amazing. I just heard you list out a number of symptoms, and obviously all of those are an invitation to book in with your dentist to do a little bit of exploring. I hope for everyone listening right now, you feel a little more inspired, a little more comfortable with booking that appointment and getting in to see a dentist.
There's a lot of people. I get it all the time. Lots. I mean, if you go to my inbox, just so many people. I'm so scared. What can I do? And so I just want you to have the courage to go, because the alternative is at some point you're going to get a denture. It's not a bad world. It's just not the ideal world. I mean, my father-in-law has been in a denture for 50 years. He eats steak. He's fine.
Wow.
But he'd rather have his own teeth.
Of course.
Okay. So there's a difference. And so, you have to kind of decide, what do I want when I'm 50? And do I want my teeth in a jar, or do I want my own teeth? And there's some things you got to do on the way there, but there are compassionate professionals that will help you along the way. So make a good decision and find the right partners.
Thank you so much for joining us today.
Sure. Happy to be here.
Thanks so much for listening. If you liked what you heard, give us a 5-star rating, and don't forget to subscribe and follow on your favorite podcast platform. New episodes drop every Wednesday.
For information and entertainment purposes only, not to be construed as medical advice. Consult your provider. The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose, or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All products, services, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.